Hi, and thank you for tuning in to the Charles E. Holman Foundation's YouTube channel. I'm your host, Jeremy Murphy, and today we are very fortunate to have with us Lyme Dr. Eboni Cornish. Dr. Eboni Cornish graduated from Brown University undergraduate with honors and Brown University Medical School. She completed her family medicine residency at Georgetown University. In 2003, as a Howard Hughes Medical Fellow, Dr. Cornish conducted translational research at the National Human Genome Research Institute of NIH. She was an apprentice in the laboratory of Francis Collins, MD, PhD, the current director of NIH and leader of the Human Genome Project. Under his leadership, she analyzed genetic associations of chronic illness. In addition to work as a medical consultant for Ament clinics, Dr. Cornish is an associate physician at the Integrative Functional Medicine Center in Leesburg, Virginia, where she specializes in the treatment of Lyme disease. Hey, Dr. Cornish, how are you doing today?
Well, I used to be in Leesburg, but now I'm full-time at the Ament clinic out there in Reston. So just wanted to clarify for everyone.
Now, okay. And tell us a little bit about the Ament clinics.
All right. So the Ament clinic, we are a multi-city clinic. We have 8 clinics throughout the country with a focus on neuropsychiatric manifestations of disease, where we incorporate SPECT scanning to actually get an underlying cause of why a person is not feeling well. So we actually look at the brain. Dr. Ament has spent years of research in SPECT scan imaging, and now we have such a huge focus on more of the integrative component of neuropsychiatric symptoms. And as a functional medicine physician there, that's one of the main things I do. I consult with our psychiatrist, and I do a lot of the detective work at better understanding why a person is not feeling well. And more importantly, I merged my practice with Ament Clinic in 2019. So I had a primary practice that focused on the treatment of chronic Lyme, Morgellons, fibromyalgia, and pediatric autoimmune neuropsychiatric diseases and associated disorders. So I've been doing functional medicine for about 10 years. And during that time there, as I work more with my patients, I understand better the need to explore the brain, the need to optimize brain health, and the need to look at that organ in order to assess what impact chronic illness has had, because the brain is key. So I have more of a focus on neurological manifestations of disease and just optimizing brain wellness, because that's key. So that's kind of what I do.
Sounds like you got a lot more tools at your disposal at the Ament clinics.
Definitely. We have a lot of tools in the toolbox at the clinic. And it's just so nice to see patients who have had, SPECT scan imaging. And during my time there, I've been trained by a lot of the wonderful psychiatrists I work with on just how to better understand certain patterns of the brain that, if they're damaged, can be associated with chronic toxins or chronic infections and other chronic disorders that cause inflammation. We call it toxicity, how your brain can look toxic. And they also have patterns that are associated with ADD, ADHD, depression, PTSD. But the important part is when we see a patient get better. And that's actually how I initially started my collaboration with Ament Clinic 10 years ago, was because they would send to my practice at that time patients who had severe neuropsychiatric symptoms, and they would fail numerous therapeutic interventions. And then the psychiatrists, they had a high clinical suspicion of toxicity.
Huh.
So they would send them to my office. I would do a functional medicine workup, and lo and behold, a lot of times there was that underlying infection, may that be chronic tick-borne, vector-borne diseases, or chronic viruses, or hormone imbalances, or gut imbalances, something from a functional medicine standpoint, that was a trigger. And so once we started to treat the cause, that's kind of when the patients started to get better from a neuropsychiatric from their symptoms. And a lot of patients even got off their pharmaceutical medications, which is our goal in our
Yeah.
of holistic strategies.
So, and just for people who aren't aware, functional medicine is a little bit different than your average general practitioner. Is that right?
Definitely. So, what we understand, our goal in functional medicine is to be detectives. So, what we do is we get down and understand the root causes of disease.
Oh,
So, we explore if there are environmental triggers, if there are causes of inflammation due to the gut imbalances from diet, from leaky gut, what effect that emotional and physical trauma can have on chronic disease.
right.
And so we just do the digging to understand the root cause. So a lot of my time with my patients, I spend just hearing their story, but more importantly, understanding the why. That was one of the things growing up, my favorite question, but why? And even during my research experience, I was always fascinated with what we call the hypothesis, the why. That's what we need to know in medicine is why people are ill, because once we understand the trigger and the cause and we put a name on it, then we not only can lead to prevention, but it will help the healing process.
Wow.
Just kind of giving medications to serve a purpose. We need to understand the underlying causes of disease.
Sounds like a healthier way.
It is. I find it is. And I think it's more or less the basic science way. It's things that we learn in med school that I thought I would never see again.
Hmm.
Incorporating things like biochemistry or physics or chemistry, looking at genetics and different markers and how they impact healing, and also how they impact chronic disease. And I also find myself learning things that I think make sense that I wasn't trained on in med school,
Hmm.
including how the brain and the gut are connected. And you should support the gut because that's helping with brain optimization, or how your hormones should be optimized in order for person to heal. And then just understanding the nature of chronic toxins and infections. So it's kind of looking at the bedside and the books, but
Hmm.
more importantly, kind of understanding how to make a person, heal themselves. Because the body is brilliant. It can heal itself, but you have to understand why it is out of balance in itself.
Wow.
Yeah.
That's really cool. That's a cool way of looking at it. Um, all right. So everybody's talking about the coronavirus. Are you getting any calls about this? And really, how bad is it?
Yeah, of course. I'm getting calls a lot and asked to speak on this topic. And the way you should look at it, it's definitely very serious. This is something you need to take precautions. People who have comorbidities and the elderly are dying at very high and fast rates because of the fact that this virus, we don't know all there is to know about it. But what we do know is that the pulmonary consequences of this exposure are serious
Hmm.
and they can occur rapidly. So that's why you hear a lot about the ventilators being used at different hospitals. We also know that it's very contagious, more contagious than the flu, and that's been shown in research. So that's why face masks and good hygiene are so important.
Hmm.
And we know how it is causing more of what we call inflammasomes, which are your body's inflammatory response to be activated. Also, something called cytokines, which just raise your body's level of inflammation and make you more susceptible to this illness. And I would think that there are probably numerous different strains because what we first thought, a couple months ago, oh yeah, the elderly, the nursing homes, they're being affected. But now we're seeing that, yes, people with comorbidities are having more complications, but it's affecting everyone. And everyone needs to be cautious during this time.
I've heard some people say that, well, I haven't gotten sick since I got Lyme disease. Is it the case? I think I just saw it on your face there, right? No
I lost my poker face. I lost
So what about being a comorbid with Lyme disease? Is that going to make your prognosis worse?
I don't necessarily want to say that there's 100% chance that it'll make the prognosis worse. But what I tell patients is that what we know with these vector-borne illnesses is that they can be chronic. We actually, in iLabs, they actually published a paper led by Dr. Shore on chronic Lyme disease that came out in publication in 2019. So we know that this is a chronic illness and it can reactivate later in life. So it also causes your immune system to be compromised. So with that being said, people who have compromised immune systems overall are more susceptible to having serious effects from this illness and from many other chronic illnesses. So that's at a higher risk is because of the immunocompromised state that occurs as a result of Lyme vector-borne illness exposure.
Wow. Gotcha. So if you got Lyme disease, watch out for the coronavirus.
Well, and also boost your immunity, right? Because not everyone with chronic tick-borne illness is ill. Some people go into remission. And those are the people that optimize their immunity by taking, the right vitamins, having the lifestyle changes, removing the junk out of their diet, taking the proper supplements, and getting their bodies to their natural state as they boost immunity. So I would say that, yes, you can have an immunocompromising condition and have worsening symptoms, kind of be your higher risk, but you can compensate for that by boosting your immune response.
Oh.
Yeah. So you gotta work hard. You got to work hard at boosting your immune system.
And there's a lot of different ways to do that, right?
Oh, definitely. I always tell patients things you can incorporate, healthier diet. I mean, we're all quarantined right now, and it's so easy to reach for the junk and to reach for comfort food. But it's also even easier to get the healthy foods, off the shelves and really take this time to try to focus, try to not shop for the sugars, to not shop for the fats, to try to focus on the fruits, even if it's fruits and vegetables that are frozen, or just doing trials right now, even with your family on gluten-free and dairy-free, so you can watch and observe the behavior changes and how your body feels. So I think the diet definitely, and then making sure you're active right now because we all are quarantined. And I recommend my patients to use kind of like strategies online, like YouTube videos, like we're doing right now. Once you stop this video, just go and click 5 to 10 minute workouts at home that you do, or low impact exercises. So things like that, trying to keep your spirits up. All of those things help boost immunity.
It's kind of cool and not cool at the same time, depending on who you're in front of, to be wearing a mask. Would you recommend doing that?
Oh, yes. I would definitely recommend mask if you're going in public. And I definitely believe in social distancing if that's what's recommended in your state, because we have to flatten the curve of this disease. I mean, it's very contagious. So, and I would do the 6 feet rule, have 6 feet between you and someone else when you're out in public. You have to take those precautions. And more importantly, washing your hands, using the soap, wash those hands. Because like I said, there are almost 14 papers a week coming out on Corona. And I learn something new every day about that.
Wow.
Yeah.
That's intense.
It is. It is.
Well, we just had some new papers come out on Morgellons. Are we at the point where we know what causes it yet?
So we do have insight on what causes Morgellons, and I always pay homage to some of the pioneers in this field, like my mentor, Ginger Savely and Marianne Middleveen, and even Eva Shoppy, the people who are on the front lines doing the publications on this illness, because they've helped us so much understand the triggers. And the publications do show that association with tick-borne diseases, H. pylori, relapsing fever, Borrelia burgdorferi, and more is coming out as we speak. But at least having those publications and that knowledge available gives us an opportunity to create more helpful, protocols to try to help to treat this disease process. So I'm grateful to know that there's not only underlying infections that contribute to this disease process, but I anticipate us having more information about what environmental toxins, specifically mold, have to play.
Gotcha. That's good news.
Yes, excellent news.
Starting to come into focus finally. Well, you said that, and we've been seeing about tick-borne relapsing fever as well as Lyme disease being associated with Morgellons. Is there any difference in clinical presentation that can kind of tip you off as to which one it is?
That's an excellent question.
Thank you.
And typically the symptoms can overlap. With relapsing fever, you'll definitely have some of the neurological symptoms. You can have neuropsychiatric symptoms, and then these fluctuating fevers intermittently, joint pain, muscle pain, cognitive impairment. Borrelia burgdorferi can present with same symptoms. And also you look for cardiovascular presentation. So what we call autonomic dysfunction, when you stand up and you feel really dizzy. Some patients have the severe form of it called POTS, because we know that these vector-borne illnesses not only affect the central nervous system, which is the brain and spinal cord, but the peripheral, which are, the way I look at it, all the other nerves in the body. So they definitely have similar presentations, and you have to put it on your differential diagnosis.
Gotcha. But you do have a way to elicit if it's one way or the other, one or the other infection.
We do testing. That's one of the things we do. Luckily, tests like IGeneX companies are able to determine specific subspecies like Borrelia burgdorferi and different species that are associated with relapsing fever, which is very useful because you cannot test for the relapsing fever strain of Borrelia via the standard testing like Quest or LabCorp. So it's extremely helpful for us to have that testing that's available. So that's what I found as a useful tool when I'm trying to pretty much differentiate between those subspecies of vector-borne diseases.
Yeah, thank you for making time to elaborate for us. I had heard that IGeneX was the ahead of the curve in regards to these.
Yeah, and they led the research on the relapsing fever, the evidence. And I actually had patients that participated in that study years ago when we were learning more, and relapsing fever was, newly emerging vector-borne disease. So definitely, I think it's great to have that information.
Perfect. Well, now, is there any test to show if someone is presently or previously infected with Lyme? These are antibody tests, right? So after you're infected, your body starts making them so you don't get reinfected. Is there a way to differentiate between now and a past infection?
And that's the controversy. There are papers. Well, let me just take a step back and explain the antibody response. So when you're exposed to an infection, you're going to present with antibodies, IgG and IgM. And let's make it very simple for our viewers. IgG is chronic. Think of G as in grandmother.
Oh.
IgM is more of a newer infection. Think of new, M as in mother. So in general, what we were taught in school was that IgM means a newer infection, and you don't develop those IgG antibodies until months later. However, we now see IgM positivity, and it's been published in chronic infections. And one of my theories behind that is, especially with tick-borne illnesses, is that they have the ability, Borrelia burgdorferi specifically, to evade the immune system, meaning that it can hide out in the host, your cells, and not be detected.
No.
And as a result, it also can compromise the immune system. And maybe once your immune system is more robust later, it may be that that chronic infection is presenting itself as a newer infection. Because I've seen patients who have had IgG and IgG positivity simultaneously. So I definitely think it is because of the person's immune response at that time of testing, which fluctuates over time. So definitely there, and those are antibodies, as you alluded to. That means you've been exposed. Now there are tests that we're looking at all the time. There are cultures, there's PCR, there's also one urine test called the series nanotrap testing that looks for active Lyme, that protein OSPA, that's active component of Borrelia burgdorferi in the urine. But the results are mixed as it relates to people who have chronic Lyme. It showed great results for patients as a result for patients who had newer exposures and had had that traditional EM rash, but not so much with patients who had chronic exposures, or meaning chronic tick-borne disease. So there are some studies for active, but it's a lot down the pipeline. And I'm looking forward to the day when we do have those answers.
Exciting decade, definitely starting off.
Yeah.
Well, is there a single approach to treating Lyme, just the magic pill?
I wish. I definitely wish. But, and every doctor has their own approach. Luckily, ILADS, which is the International Lyme and Associated Diseases Society that I'm a member of, published guidelines a few years ago, which were evidence-based and peer-reviewed, where we gave our guidelines to how to treat certain tick-borne diseases. I'm actually a board member of our educational foundation, which is a sister organization to ILADS. And so we train physicians around the country on how to treat tick-borne disease. And we have annual meetings, training courses. But you know what? The first thing I tell docs, this is clinical. You have to use your clinical judgment when you're treating patients who suffer from vector-borne illnesses. So I don't think there's a magic protocol. We do have guidelines, but we find that patients get better from both antibiotics and also integrative strategies. So you have to look at both. So there is not a magic pill, and one person's protocol may be completely different to the person right after them. And that's just the nature of this chronic illness.
Wow. So it's not like other diseases where there's a cure. This is something that varies between individuals, huh?
It does. It definitely does. But like I said, we do have our standard guidelines with things like doxycycline, and we have protocols for other co-infections like Bartonella and Babesia. So we have certain agents that have been shown to be useful. But what I'm saying is that sometimes patients need more than just the basics to get better. And that might be due to other factors contributing to that individual, their genetics, their environmental toxins, and other things that impact their inflammatory burden. Like some people have tick-borne disease and are not symptomatic at all.
Yeah.
Life. But then there are some people who get that similar exposures and they're bedbound or they're wheelchair bound. And then you have others who may present with the dermatologic manifestations of Morgellons disease. And then, it's all over, but we have to use our guidelines, which we have published, but you still have to look at each individual's triggers and their environmental burden, kind of tease through all of that in order to get someone to remission.
That's where looking at the whole picture really comes into play, huh?
Yeah, definitely. That's mandatory.
Wow, that was a great answer. Thank you. Um, what about Justin Bieber? He's out. He's got Lyme disease, and but he's also got Epstein-Barr virus. And I don't know too much about Epstein-Barr virus. Is that a serious infection we should consider? And how does it impact Lyme disease?
Yeah, and Justin Bieber, he had his documentary, and our Dr. Ament, was a part of his healing journey. We
Oh wow!
at the clinic were able to look at his brain, so that was something that was in his documentary. So
Cool.
that just also shows you what impact chronic infections can have in neurological manifestations of disease, because he had more neuropsychiatric manifestations, and then they treated, from what I was able to gather, the underlying infections, and he got better.
Huh.
So with chronic, so when you think about this toxic milieu and all of these infections, the way I tend to frame it is that the infections are a trigger, okay? But what happens is our body's inflammatory burden, may that be from emotional, physical stress, other environmental toxins like food and gluten, wheat, mold, all of those environmental toxins make us inflamed, and that compromises the immune system. So that now these bacteria and viruses are more virulent and more active, and you become symptomatic. In the case of chronic mononucleosis, in most viruses, there are no cure for viruses. Okay, they go into remission. It's kind of what we see with Borrelia burgdorferi. We don't have cures. These diseases go into remission. But when there are things that change your body's inflammatory burden, they flare back up again.
Mm.
So that's what happens with the majority of my patients. It's not exactly that it's just the infection per se, but it's what the infection does to the inflammatory burden that makes this process, more burdensome and cumbersome, and people suffer for much longer. So that's one of the things I always stress to my patients, that the infection is one component of this entire toxic milieu. And there's a doctor by the name of Robert Navarro. He published an amazing study that a lot of us in functional medicine refer to on kind of the cell danger response. And what he found was, like I was telling you, that those triggers, may that be environmental or physical trauma, emotional trauma, changing your lifestyle, all of those are attacks to your inflammatory burden,
Hmm.
and they affect your part of the body that produces energy, the mitochondria. So that is what prevents the body from healing. Okay, this is cell danger response. So you have these insults, but then it's a common response of your body just isn't healing because of repeated exposure to all these different insults that happens. And that's how what I think happens with chronic tick-borne disease and with Morgellons. It's more of like this vicious cycle of these insults that are triggering more inflammation in the body.
So that's what you mean when you say like the cascade effect, right?
Exactly. And that holds true, I would say, in about 80 to 90% of my patients, because that's one of those things, going back to understanding the why. Why does this one person present with this severe response, this severe toxic response? And that's why you have to do the digging and find out all the other triggers that cause it.
I know a few people who are concerned about having children because they have Lyme disease. Is that something to be concerned about, or is it okay?
Well, being a mother of triplets, you get concerned about having children regardless. No, pregnancy is a beautiful thing. Motherhood is a wonderful thing.
Yeah.
And there can be, because the research, it's like a controversy within a controversy. There are small studies, and most of this is anecdotal, that state that mothers who have vector-borne illness there's a high risk of transmission to the fetus. So, but I've had a lot of women who've had pregnancy. I even have quite a few patients who are pregnant at this time. But I do see a higher risk of miscarriage because that's another stressor. Underlying disease is a stressor on the body. I do see that quite a bit, but there's not a guarantee that, oh, if you have this underlying illness, you're going to transmit it to your child.
Yeah.
I think the literature had shown, like I said, it's very controversial in very small sizes, that it was about a 50% risk of transmission if a mom was untreated. And then that rate went down to around 30% when the mom was treated during pregnancy. So there are antibiotics that a lot of Lyme specialists, including myself, may use during pregnancy, which include amoxicillin or zithromax or cephalosporin class, which are safe for pregnancy. But it definitely is individually based. I have moms who told me they've been asymptomatic for years, because I tend to have like a prenatal protocol for my patients that I want you symptom free. I want you on off all supplements and meds for X amount of time, depending on that case. And that way we can feel comfortable that you're in remission. And then we do all the necessary testing, not just looking at infection, but going back to what we said about other triggers. I screen for metals, heavy metals cross the placenta. I make sure I'm optimizing the gut, because literature out of Europe says probiotic use during pregnancy boosts your immune system. So it's not just one factor. And I make sure that I'm optimizing those, your minerals, your vitamins, making sure we're removing those toxins, even mold and other environmental toxins during that pregnancy stage. And that's what I do for all patients. But specifically for my patients who suffer from vector-borne illness, we're very cautious, but it's not as if it can't happen. You just need to use caution, and you need to have a high-risk OBGYN during the pregnancy.
Yeah, that seems more likely a winning strategy.
Mm-hmm.
Now, like for example, polio has a common outcome that affects the body. Does Lyme disease have kind of the same thing, where if somebody's got Lyme disease, they can say, well, in 50 years, you're going to have dementia, or is it different for each person? What are the outcomes of Lyme disease, and how common are they?
So there are numerous outcomes. So when we say Lyme disease, we're really talking about what we call Lyme Borrelia complex, or vector-borne illnesses. So there are more than just one infection. So earlier we mentioned Borrelia burgdorferi, as well as relapsing fever Borrelia.
Yeah.
And some of those stages, late stage Borrelia, ending with kind of the neurological. I've had neurological manifestations of disease. I've had patients who've had cognitive impairment or have been misdiagnosed with things like multiple sclerosis or ALS, or even they're showing Borrelia, papers that are associating Borrelia burgdorferi with Alzheimer's, dementia.
Yeah.
So the neurological manifestations are some of the ones that are more chronic and in late stage. But then you have co-infections, which are other infectious organisms. Bartonella is one that's neurologic, that penetrates the central nervous system. And you think of numbness and tingling and confusion and, some of the common symptoms, pains on the soles of the feet, or something like a brain fog. And Bartonella is associated with dermatologic changes as well. You can see like nodules under the skin that are pretty hard when you press on them, or stretch marks that are striae, look like, red stretch marks, like a cat scratched you, which in some cases can be a patient's primary complaint. I've seen patients who've had no other symptoms, but just have had those stretch marks.
Oh.
And then, the tick-borne parasite, babesiosis. And babesiosis and Bartonella, they both live in your red blood cells. So they can become inside the red blood cells. And with Babesia, it's very, very similar to malaria. And so patients get a lot of sweating. They get that blood pressure change that we refer to, and a lot of neuropsychiatric symptoms as well, and air hunger, difficulty breathing. And then the list goes on and on. There are other co-infections as well. That could be a whole nother call for another day. But there are different clinical manifestations. So when I say use your clinical judgment, that's what I mean, because there are certain clues that can lead you towards your diagnosis that you see on physical exam.
Wow. So they actually live inside the red blood cells, and those things are supposed to be carrying oxygen through your body. So,
Exactly.
wow. Okay. Okay. Um, okay. Well, here's a topic I know you like to talk about. What about mold? What does mold do to the body?
Everything.
Wow.
Yeah, the reason I speak about mold so often
Yeah.
is because I find that when patients remediate mold, or we find out that they have mold toxins, which are called biotoxins, circulating in their body, and we're able to treat that, that can be that missing link that gets them to remission.
Mm.
So, the research, and one of the pioneers in the research is Dr. Richie Shoemaker and Joseph Brewer. They both looked at a lot of the research with water damaged buildings. They found that patients who had entered water damaged buildings had suffered from numerous different, biological imbalances.
Yeah.
Richard Shoemaker illustrated in a beautiful paradigm how patients who had genetic predispositions for retaining mold toxins, meaning that person could go in a water damaged building years ago. And because they're genetically susceptible to mold toxin retention, those toxins can become, they live in their body for years to come.
Oh.
And they can cause things like chronic fatigue, cognitive impairment. There's an association with biotoxin illness and immunodeficiency because white blood cells don't respond effectively, and you start having these prolonged illnesses. And also, they can compromise your hormones,
Mm.
hormone production, your cortisol, your sex hormones.
Yeah.
So, mold is huge. And that burden that's created by biotoxin illness can affect numerous different systems in our body. And I remember years ago, I would find myself treating. I'm doing all the protocols for Lyme, and why is this patient still clinically stuck? And lo and behold, as I started to transition into biotoxin illness, that was a missing piece because it compromises your immune system. And remember, I said that's what the balance is, it's the immune system and this inflammatory burden. And so, if mold is present, you're not going to get better. You're
Mm.
not going to heal. It was a great article Richie Shoemaker came out with years ago, and he said surviving mold is surviving Lyme. And
Yeah.
I believe that. And I call it with my Morgellons the M&Ms, Morgellons and mold, because so many of my patients who suffer from Morgellons disease or Morgellons syndrome have mold exposure or have biotoxin illness.
Now, mold, you were talking about water damaged buildings. We were discussing water damaged buildings, and that's pretty much everywhere that it's humid. Is it not just going inside the buildings, but those buildings themselves are like shooting mold out into the environment?
Definitely, definitely. And that can also be in the home as well. So, as I stated, some people can have exposure to mold and they're asymptomatic.
Wow.
Other people can have different genetic variants and they are more likely to retain or hold on to those mold toxins. So you have two people getting the same toxic exposure. One person's fine, leaves, goes without a problem
Yeah.
because mold is everywhere. But there are some people who are, when they are susceptible to it, they start to have this systemic inflammatory burden. And that's what we call chronic inflammatory response syndrome. You start to have
Oh.
a systemic inflammatory response and it prevents you from healing. So I think it's a combination. And even right now, a lot of my patients who are now quarantined have reported, some of them have reported worsening symptoms because they're in their home more, right? And so I'm really adamant about test your home, clean your home, Make sure you remove, because you really won't get better until that environment is clear. That's
Yeah.
the first step to mold remediation in biotoxin illness is move. You have to test the environment and you have to move. There are some doctors who won't treat Lyme or other infections until they treat mold. And I can understand why, because it does prevent healing.
What about dehumidifiers? Do they help?
Yeah, they do. Definitely dehumidifiers help. Making sure you're cleaning adequately, that helps. Making sure you're not eating foods that are rich in mold, like old leftovers, fermented foods. I tend to tell my patients
Oh,
with mold to be more on a paleo diet, more of like a fruits, veggies, that kind of diet, fresh fruits, no gluten, no sugar, and watching out for those leftovers and and then surprisingly the fermented foods in mold patients can cause reactivity, because we
oh,
think
wow.
gut fermented foods are great, but that's another thing that you want to avoid. So yeah, I mean, there, and then binders, those are things that you might use to help remove mold from the body, things like charcoal or clays or cholestyramine, depending on what mycotoxin or mold toxin a person has. You may be able to help remove them out of the body.
Okay. I appreciate you elaborating on mold. Can I ask you just one more question about that?
Of course.
Hey, thank you. Um, Testing. How do you test for mold?
Well, the most important test you have to do is your home. And I typically recommend things like petri dish testing, one of which is I use commonly is immunolytics, or hurts me too, or ERMI testing, because that's a Swiffer test. You want to test on the surface areas, because a lot of these toxin molds, these mycotoxins, are heavier. So they're usually found on the surfaces. So I have a lot of patients tell me, oh yeah, my home is clear, but they've only done air sampling. And then
Oh,
when I have them go back and then do the surface testing, that's when you pick up those mold toxins that are the mycotoxins that I'm referring to, the heavier, the ones that are by the nature of gravity found on the surface area. So I always recommend surface testing. And then the urine testing, they're controversial, but I do them. I do find them extremely useful to have urine. There are companies like Great Plain Labs and Real Time that I use traditionally in a lot of my patients, that will test not only for those airborne mold toxins, but also things like ochre toxin, which is not only found in water damaged buildings, but found in your food. So they list for you a level of toxicity for your mold, for the mycotoxins. And then you can develop a treatment strategy based on the results. But the most important treatment strategy is to remove yourself from that if it is your environment.
yeah. If you can get out, I know a lot of people have to stay where they're at just because they don't have anywhere else to go.
Yeah,
But you can identify what kind of mold that is, and then kind of zero in on how to treat it.
exactly. And
That's excellent.
sometimes you can even do local remediation, because a lot of people can't move. You're absolutely right. So using the filters, the HVAC, doing the proper cleaning, and sometimes you can even get products like foggers, things that do local home remediation. I found I had a patient of mine. This is a great story. She had Morgellons,
Yeah.
and she had recurrent high levels of candidiasis, yeast in her body, when I did her antibodies, very high. She was very ill, and we did her mold testing, and she had a few in her urine. She had a few molds that were present, but then we tested her home, and we did petri dish testing with immunolytics. She was growing Candida, that yeast, in her home environment.
What?
Yes. So and I had treated her with numerous antifungal protocols, herbals, prescriptions, and we found out it was in her home. And then she got her home remediated. And Jeremy, her Candida titers finally went down.
Huh.
And, the longer I'm in functional medicine, the more I learn and the more humble I become.
Yeah.
Because if you go to a doctor who's doing functional medicine, and they tell you they know all the answers. They don't. I learn something new every day about how the body works and how these toxins affect you. So that was a great story. That was bad. It was yeast growing in her home.
Wow.
Yeah,
Wouldn't think to be looking for yeasts.
not at all. Not in the home. That was now I do. But, she was my first case. And since that time, I've seen so many more cases of that. And they've removed it and felt better.
Now, Candida is our next question, but so that's a good segue. But can you elaborate a little bit? How does someone grow Candida in the house? Are they baking bread all day, or how does that work?
That's an excellent question. And I've been trying to evaluate from the source. One person I made who is a mold remediator, he said that from plants, he said it could also just be, in the environment. We're still researching that. So I don't have a definitive answer, but all I know is that it can be cultured and you can find out if it is in your home environment. And I also know that it can become systemic. You can have that exposure and that become another systemic inflammatory toxin in the body.
How do you know if it's in your body?
So you can test with antibodies. So I routinely check for Candida with standard testing, and this is covered by insurance, IgA, IgG, IgM, and they will tell you. Remember, once again, the IgM and the IgG, new and older. The other antibody, IgA, can look for in the small, like in the intestines. That's usually sometimes it's in the smooth muscle areas. And that gives me that insight. And you can also do stool testing to see if there's candidiasis or yeast in the stool. And then on your tongue, putting your tongue out, if you see white, thick plaque on your tongue, that can be a sign of Candida overgrowth. A lot of times patients tell me sugar cravings. If you're craving carbs and you're craving sugar and you're constipated or you're eating those things and you all of a sudden look pregnant afterwards, that could be a sign of what we call gut dysbiosis or yeast in the intestines, Candida overgrowth there. And then rashes. Some rashes are yeast, and women know also vaginal yeast, vaginal itching and discharge can also be clinical signs of yeast. So you can definitely make the diagnosis of yeast clinically. And you can also do it on the lab work and also on stool studies. So yeah, you can test it and you just learn, you can test it in your home as well. So yeah.
Do men also get kind of a yeast infection in a similar regard?
Yes, of course they do. I don't see a lot in my practice of yeast infections on the urogenital tract, the male tract, as much. But I have patients who have the systemic candidiasis, because let's talk about one thing to know about yeast. It naturally lives in our gut. We live with good yeast. We have yeast in our gut. And over time, when our gut becomes impaired, then Candida and other forms of yeast can leak into the bloodstream or the body. And that's called, systemic yeast. And not only that, yeast, the research shows, can cross into the blood-brain barrier.
Oh, wow.
So they have a lot of research showing how systemic candidiasis, yeast infections, can cause depression, can cause cognitive impairment. So it's not just, oh yeah, I have a, white tongue. The results of yeast can cross all different, organs, including the central nervous system.
Are mold and yeast alive like bacteria? Or are they not like viruses?
Yeah, they're alive. They're living organisms. They definitely are. They're living organisms. When we do mold studies, the mycotoxins are toxins produced by mold, which is different. Those are the toxins that are produced. So not every mold is toxic. Specifically at those toxic molds, some of the ones that are found in water damaged buildings, because that's where you start getting the problems. But yeah, they're living organisms. They're fungi in that family.
Is cheese a good mold?
That's a great question too. Some cases there can be. I'm not going to rob everyone of their dairy or their cheese today.
All right.
A lot of hate mail. But it can, some of the aged cheeses Richie Shoemaker and others and myself, we recommend using caution with the
Gotcha. Gotcha. How about the antibiotics? The long-term use of them is typically what we see in regards to chronic Lyme disease, but can the long-term use of antibiotics result in permanent bodily damage?
And the answer is yes. Long-term use of antibiotics, it's a gift and a curse. It's needed in a lot of cases, especially with my Morgellons cases. I have utilization of formal antibiotic strategies because I like to look at it as kind of the get in, get out mentality. Sometimes these organisms that cause these systemic infections, you do need to incorporate antibiotic strategies and follow guidelines, in addition to integrative strategies, because I don't think it's just one way to treat these diseases. I think you need a combination of both. But even starting from childhood, there's research that shows children who were exposed to antibiotics in childhood were more likely to develop neuropsychiatric symptoms later in life. And I think it's also true with adults that once we take antibiotics and we know they do damage the gut, and they can lead to what we call leaky gut, because our gut is our second brain. We have to protect it at all costs. That's where the majority of our immune cells are produced that fight off infections, okay, in the gut. Those chemicals like neurotransmitters, serotonin, and dopamine that are produced in our intestine, in our gut. And it kind of gives us that harmony that we need. And it's connected to the brain with the longest nerve in our body called the vagus nerve. So the gut is protected like with these cells around. It's called the gut border. And when you abuse the gut, with antibiotics or toxic foods and stress, that border opens. And that's what causes a leaky gut. So now things leak out the gut that shouldn't. And one thing that you don't want to leak out the gut is stool toxins. We call that endotoxins, toxins produced by stool. And then things leak inside the gut that shouldn't. And that's what causes your immune system to misfire and, you to start having these autoimmune phenomenon. And then you start having neural inflammation, brain inflammation due to leaky gut. So antibiotic utilization long term can definitely impact the gut negatively. That's why it's imperative that you support the gut with the necessary healing strategies to try to prevent that at all costs as much as possible, so that you're treating, but then simultaneously you're working to compensate for that damage by healing the gut lining with the proper protocols.
So the damage is reversible, or the
damage is definitely reversible. The functional medicine approach to the gut is called the 4 Rs. So it's remove, replace, rebalance, and repair. So you first remove the things that damage the gut. So, for example, when I have patients who are on things like antibiotics, I make sure we're removing other gut inflammatory agents, which is true for everyone, like the alcohol and the bad food choices, and other bad bacteria that can be located in this microbiome. So you want to remove those things. You also want to replace the gut, the ability to use good enzymes to break foods down into smaller, so those are like digestive enzymes that go and they kind of help break your food into smaller particles. And then the most important, you work on repairing that gut lining, because I told you that can be impaired when you take the antibiotics or exposed to other toxins. So you want to repair that. And that can be with strategies like glutamine, slippery elm, licorice, all those things, amino acids that heal and close that gut balance. And then you want to re-inoculate by making sure you're giving good probiotics. I tend to rotate between things like spore-based probiotics. One of my favorites is Megaspore. And I also really love plant-based probiotics like True Bifido and Theralac and orthobiotics. And then yeast, there's room, especially in mold illness, for those yeast-based probiotics like Saccharomyces. So you really have to make sure patients are on a very comprehensive gut protocol, all patients in general, when they're suffering from chronic illness. But it's even more important when you have the patients who are on antibiotics that you take the time to stabilize the gut and you monitor it.
So just so I understand, any permanent damage would be a result of neglecting the leaky gut from the antibiotics use, but you can mediate that by protecting the gut lining in the process of that protocol.
You're absolutely right, Jeremy.
Hey, thank you for making time to explain that. That's, I think, a very important point that a lot of people should understand. But now, is there a point in treatment where patients become better off antibiotics than on them? And is that a typical scenario that occurs that you see routinely?
So one of the things that I incorporate, one of the many protocols, I incorporate what we call pulsing, where I may give patients a few weeks on, if they're on an antibiotic strategy, if I feel like they have severe symptoms that warrant antibiotics and they failed natural herbal strategies. So that'll require you take time on therapy and then you have a break off that therapeutic intervention, which allows for you to assess the body at baseline. We know that with Borrelia burgdorferi, there's a such thing as persisters. And what that means is you can take the treatment, but it becomes more chronic because it converts into a more of a resistant cyst or biofilm form, or becomes a persister that then reactivates once the antibiotics and other therapy is removed.
Yeah.
So you use those break periods to not only assess the body at baseline again, but you want to see how well you're actually treating the disease in a lot of my cases. But I do have some patients that can't tolerate antibiotics, either due to terrible gut or multiple chemical sensitivity. I remember my first patient I saw with toxicity, it's probably 9 years ago. She could not tolerate 1/4 of a doxycycline. She couldn't tolerate it. She was in the ER. She had such a bad cell danger response and inflammatory response that she had what we call severe die-off reaction, or that Herxheimer inflammatory response is what it's known as.
Right.
And in those cases, you have to make special accommodations and proceed slowly, because they may only be able to tolerate natural strategies. They may take longer because you have to go slow. So that's what I mean about it's not a cookie cutter protocol when it comes to treating disease, because you'll find patients that are all over the board. I have some patients who can comply with, comprehensive protocols, intracellular antibiotics, extracellular, cyst form, those that treat the cyst form. Then I have some who can't tolerate herbals. So because of multiple chemical sensitivities. So you definitely have to use clinical judgment when you're treating patients who suffer from vector-borne diseases.
Gotcha. Well, something that a lot of people have a hard time dealing with, especially with Lyme disease, is getting to sleep. How much sleep is healthy, and what can someone take to help them promote a healthy sleeping habit?
And I see that often. What I'll find is I'll have patients who have, that's one of the first things we focus on is sleep.
Yeah.
Because if you don't sleep, your body won't heal. So I'll have patients who may have what we call fractured non-restorative sleep, meaning they are sleeping, but they're not getting into a deep REM sleep. So they wake up exhausted. I have patients who just have anxiety or a high stress response and just can't go to bed at night. They sit there tossing and turning. I have so many patients, Jeremy, where they have problems with sleep because of sleep apnea. And they're not getting the oxygen to their brain, and then they're wondering why they're not getting rest or why they're fatigued, because they're not getting the oxygen flowing to the brain. So sleep is mandatory, and at least 8 hours of uninterrupted sleep. That's how
Wow.
our brain heals. That's how our immune system heals. That's how our mitochondria heals. And that's one of the first things I work on in every patient. And sometimes it's as easy as good sleep hygiene, you know, finding out why a person isn't sleeping. Some people are, oh, I'm a night owl. Oh, my sleep pattern, especially I have shift workers. My sleep pattern is reversed. Oh, I did, so it's getting into that routine of trying to go to bed at the same time every evening. That's kind of the first step, trying to get into a routine to go to bed at the same time nightly. And then if you can't sleep, finding out why that is. Is that due to a physical issue, like I said, with the snoring or, other things, too much electronic magnetic frequencies, all this Wi-Fi that can cause a person to have sleep problems, and insomnia. Is it anxiety that's causing the sleep problems? Is it all these other infections? We know that mold can decrease melatonin stimulating factors and cause your sleep to be impaired. Vector-borne illnesses and chronic infections can do the same thing. So you find out why a person isn't sleeping, and then you can support sleep, not only treating the problem, but things that are like CBD oil. I'm a big proponent of CBD oil to help with sleep, or melatonin. There's a agent, Magnolia, it's called Hanopure. I found that that's anti-analytic. It calms down
Oh.
your anxiety, but it also helps with relaxation and sleep. And some patients do mindfulness. I have my 3-year-old triplets right now before bedtime. They're doing this Sesame Street Elmo deep breathing song, and it's just the power of deep breathing and resetting those adrenals right before bedtime, and they're out. And I'm like, hey, 3-year-olds are doing this. So I'm sure my patients can benefit from evening mindfulness as well. Or so those are different strategies, among many that you can take. But there are definitely a lot of tools out there, natural remedies, things like GABA also,
Hmm.
that help get you to bed at night. That's important.
Can sleep apnea kill you?
That's a great question. Sleep apnea can make you more prone to other health conditions that are very morbid, like diabetes and obesity and high blood pressure and hypertension and cardiovascular, because you have the cardiovascular events. Because you have to think about what's happening. You're not getting oxygen to your brain.
Oh.
So, yes, that can be traumatic and that can be deadly because you're not supplying the brain with the oxygen it needs to heal. So, yes.
Is there a way to tell if you have it? I think a lot of people may have it and just don't know. It-
So I do a sleep scale quiz when I'm treating new patients, and just asking general questions like, do you snore? Does anyone ever tell you that you stop breathing? A lot of times people just aren't refreshed in the morning, and they may not snore, but they may have that apnea problems. And I recommend quite a few patients, I send them out for sleep studies because
oh,
that's key. If you have sleep apnea, then that will also prevent your immune system from healing. So, snoring, inability to lose weight, daytime fatigue, asking friends and family if they stop breathing, if your spouse or whoever's in bed with you, if they notice that you stop breathing while you're sleeping, all of those could be easy signs of sleep apnea that need to be addressed.
wow.
Yeah,
Pretty serious condition then.
very.
Um, but what about appendages falling asleep, like your arms, legs? You wake up and it's like, oh, it's tingling all over. Is that a symptom of the Lyme disease, and what can be done to remediate that?
That's what we call neuropathy.
Okay.
So there's a problem with the neurological system, problem with the signaling pathway. So that numbness and tingling, or the falling. My people report all the time. My arms feel like they fall asleep, or some people even have 2 minutes like biting and tingling and itching. at night as well. And definitely you can do things that can support the neurological system. So magnesium is great. Things
Yeah.
like low dose naltrexone will help kind of with that nighttime neuropathy. Treating the underlying causes, if we find that chronic infections or toxins is causing having a negative impact on the neurological system, that also needs to be addressed. Because remember, you think about those triggers. Why is this happening? What is the cause? And treat that. But I definitely, alpha lipoic acid, that's another agent that can help with those evening neuropathy. Sometimes antihistamines. If that numbness and tingling is more of a histamine response that people can produce. Sometimes the antihistamines, things like quercetin or compounded antihistamines like ketotifen, or even over-the-counter antihistamines can also help with that, that kind of neuropathy, which is what you're referring to. So it's a lot of tools out there that can help with that evening neuropathy. And then you also want to make sure you rule out restless leg syndrome. I have a lot
Oh,
of patients who may have restless leg syndrome and not know it, and then they get treated. You can be treated with prescription medications and also some of the other agents I prescribe, and that can help lead to better sleep quality as well.
um, and that's kind of a specialized condition, but it's all part of the Lyme complex.
Mm-hmm.
Do you, being a functional medicine practitioner, ever recommend patients out for any reason? And typically, what do you recommend them out for when you do?
I definitely collaborate. Like I said, you have to be humble enough in this field to realize what you don't know, and also to realize that some things you may need collaboration on. Luckily, I've surrounded myself with some really great doctors in the field and even great allopathic doctors. And, I have some friends of mine, other board members and leaders in line. We have group chats. We may text about interesting cases all the time, or even at work, we may present cases to one another and come up with new strategies and new ideas. And then going to conferences. I'm always trying to go to as many conferences as I can or speak on any platform that I can, just to learn, just to evolve. And so I typically send patients sleep apnea. I definitely will use a lot of sleep doctors. I use a lot of integrative physical therapists. So I have physical therapists locally that I work with that do more specialized maneuvers that help with detox, like what's called lymphatic drainage or
Oh,
visceral manipulation, where you're allowing the liver and the gallbladder to kind of filter those toxins out. You're
oh,
opening the lymph nodes to clear toxins. And then some people just need physical therapy for joint mobilization and to help, with kind of mechanical interventions. I collaborate with cardiologists because I have a lot of patients in my practice who suffer from what's called POTS,
yeah.
is postural orthostatic tachycardia syndrome. So they stand up and their blood pressure drops by greater than 30 beats per minute, and pulse and heart rate go up to 120 or greater, and they're dizzy. So sometimes cardiologists can help me prescribe the proper medication for those patients. And I do a lot of collaborations with therapists and psychiatrists, because when you're suffering from chronic disease, it can take a mental and physical journey. So I'm always a believer that neuropsychiatric disease, the psychiatric component isn't the cause of the disease. But I think that the disease itself, in a lot of cases, can trigger psychiatric symptoms, especially because some of these diseases, we don't have that. You don't look ill, is what my patients always say. My family can't tell me that I have, Lyme, because I don't look ill. Or in the case with my Morgellons patients, a lot of times patients, they don't get believed or they get dismissed. And I call it the life and the Lyme, the LNLs. Those things can take a toll on you, and it's okay to say that. But it's not the cause of your illness, but it can be as a result of your illness. And having that psychiatric support, that emotional support is needed in a lot of cases. So I definitely think it's important to collaborate.
Lack of emotional support can prolong illness.
Yes, definitely, because you need to be not only supported, and it's hard to sometimes find that support, but having the supportive family, having doctors. I can't tell you, Jeremy, how many patients, when they come into my office, I rarely get the patient who said, hey, I just got a tick bite yesterday. I typically get patients who are referred to me from other doctors who may not have been able to figure out what was wrong. So they sent them to Detective Cornish. I got coined that by a colleague of mine. Or the patient in the case of my patients in the case of my Morgellons population who have been dismissed for years or have tried to use tools from online resources and try to find people to understand what's wrong with them and to just be heard. And that also can take effect on your mental health. And that stress response is key. So depression and anxiety and all those other neuropsychiatric issues can not only happen because of the infection, you can cause those things, but just the life component. And I think that emotional support and that well-being is important. I always tell patients, don't give up. Chronic illness, because people are suffering for quite some time, and it takes sometimes in some cases, long time to heal. Don't let it bring your spirits down. Don't give up on, whatever it is you believe in. Don't let it just take over you completely, because the body is brilliant and the body can heal itself once you find the right health person to help you on that journey. So that's something I always encourage. I even give some patients Student of the Year awards, and I have that most compliant patient, because encouragement is key. You have to really encourage yourself to keep going. And, and once you get into that black hole, it's hard to get out of it. And that's why we're even seeing with COVID, the rates of suicide are going up,
Yeah.
And it's troubling, but people just need to understand that it's okay if you need that help. It doesn't mean that that's why you don't feel well, because so many people get, oh yeah, go to psych. And believe me, when I first started in medicine years ago, I was that doctor. I can't figure it out, go to psych. But they aren't psychiatric causes that are the reason why you're not well. But when you are suffering, you can then develop psychiatric symptoms because you're human.
Right.
So, that's the way I look at it.
And it's only a temporary situation. One day you turn around and look behind you and there's 5 years where you've been healthy.
Yeah. Yeah. It's just you can't give up, because when all functional medicine, you have your ups and downs, because that's the way the life works. I have patients who get into remission and I won't see them for years, and then they get another stressor. May that be another infection, or they change their diet, they change their lifestyle, they have a toxic relationship, they lose their jobs, something that's a stressor that causes this whole, metabolic imbalance, and then they flare up again.
Oh.
And that can be disappointing, and that can be very frustrating. And especially when patients don't get the answers they want right away, because patients get better, but you might not get, like, I've been doing this for so long, I want answers now. That can take a toll on you, and a, spiritual toll as well. So you just always have to keep fighting. And I tell my patients all the time, I'm going to keep figuring out the answers. I'm going to keep getting you better. I have a huge toolbox. And what I don't know, I'm going to find out what I'm going to learn. I'm going to find out the answer. So don't give up on yourself if you have doctors who are still in the trenches, not giving up on you. And you have to also forgive yourself. Forgive yourself when you have those down days. Forgive yourself when you have those times when you just feel helpless. Forgive yourselves when you have those non-compliant days because you just want to throw it all away and you're exhausted. And just know that the best is yet to come. I end a lot of my letters to patients with that thought, because it's true. The best is yet to come. And I've been in that situation, where when I had told I had triplets, I was like, oh my God, it's different, but it's still like what? I'm frightened. And, and then you go around like, triplets? Who has that? Natural what? And it's a state of fear. And that can take a toll on you spiritually. But then you just have to say, you know what? I'm going to make it through it. I'm going to see what happens. And I'm going to forgive myself for those bad days and keep it moving. And that's how you have to look at chronic illness. Just keep working. It's going to be some ups and downs, but just keep working through it. And don't let your spirit down.
I think a lot of people lose self-esteem because in light of the illness, and they get to feeling like they're just not worth it. But that's not true at all. Everybody contributes to society. Everybody contributes to this life that we're all existing in, and everybody is worth it.
Yeah, it is. And, for the patients who suffer, just know when we're in these fields, like treating chronic complex illnesses, it takes a toll on the doctor as well, because we want to have the answers. We want every doctor wants that patient that leaves their office to be recovered. Every doctor wants to feel like we went to school and we know how to fix this person and we have the blue magic pill. That's rewarding. That makes you feel great. Now, I've had a lot of patients who are successful, and that is rewarding, especially when, even with my Morgellons patients, when people get into remission. But then you have those bad days where you have to reevaluate and say, okay, I'm going to keep fighting for this person. What else don't I know? What else is out there? Let's go back to the trenches. Let's read. Let's collaborate. Let's study and get this person better, because we all have the ability to do so. In chronic illness, you can get better, but it may take more time for some people than others.
It's enough to drive you to drink, right?
Drink water with lemon in it.
Sure, but what about alcohol? Is how much alcohol is okay to drink?
So, I have to be honest and tell you, at our clinic, we found a lot of studies showing the damage of alcohol on the brain. Yeah. Everyone's human though. And I know with the Mediterranean diet, it shows how red wine has polyphenols, one of which resveratrol, which is anti-inflammatory. Yeah. I always have patients that tell me that, well, here's this study, Dr. Cornish, you told me to abstain. But you always have to think about what else is going on in your, toxic inflammatory milieu. Now, if you're drinking and eating toxic foods and you're on meds, that are just abstain, especially if you know that you are having chronic symptoms. I would just say put it on the back burner. But for, people who are healthy, having an occasional red wine can be helpful, but just don't overindulge. But especially if you feel as if you are suffering with any kind of symptoms and you want to do the best to optimize brain wellness, just put it on hold for a while. Get you some resveratrol, the supplement. Hey, there you go.
There you go. Yeah. The non-alcoholic polyphenols. Okay.
Yeah, that polyphenol. But, I typically prefer my patients to abstain. And I know it's not realistic. We need to be cautious, especially with COVID. Yep. There's a lot of overindulgence right now with alcohol. And that ties back to, what we were saying earlier about this quarantine and its impact on mental health. There's a lot of overindulgence with alcohol, with poor dietary choices, with mood changes. But that's just something to be cautious with. We don't want to have damage to the liver, but not only that, you don't want to add something else to this already inflamed milieu that you have doctors trying to fix and trying to evaluate. That's just going to be inflammatory. You don't need it, just pause. It's like we have to go through it for 9 months when we're pregnant because we want to optimize fetal health and development. So we definitely know there's something to be said of negative impacts of alcohol on the brain and on the body. So just take a break. Just abstain.
Kind of makes your job a lot harder when somebody's drinking and trying to.
Yeah, it does. And it makes their job harder as well, because it is so inflammatory. So I just really, you don't want to be hypocritical as a doctor and say everyone abstain 100%, because that's not fair unless you're doing it yourself. But you need to make sure if you are symptomatic or you're suffering from chronic illness, that that's just something easy that you don't need to introduce.
Right.
You don't know what interaction is going to have with other things you're taking, the interaction it has and the negative impact on the brain. It's just why? Why do it? And what are you using it for?
Yeah. What are you using it for? Exactly. Okay. Because there's a difference between just having a fun drink every now and again and trying to forget about those 20 years.
Exactly. Exactly. And I mean, in my patient population, and I would think a lot of doctors who treat chronic patients who have chronic illnesses, you do have higher rates of, history of alcoholism or substance abuse, because it kind of masks your feelings and it kind of takes you away. Or I had one patient who told me, I drink every night 4 glasses of vodka because I need to sleep. So
Jesus.
some people use those substances as self-medication. So you just have to ask yourself, well, what am I drinking for? Am I drinking it because I feel like I'm suffering and it allows me to escape? Or am I having my occasional red wine, for celebration? Why? Why are you doing it? Are you binge drinking to feel good? What is the use? What are you doing it for? And that's something that you would have to answer.
Gotcha. Gotcha. It's kind of a self-medicating mechanism, but not the healthiest
No,
available to us.
no.
The last couple of questions, Dr. Cornish. I think this has been a great interview so far, definitely. And we all appreciate you being here. I'm seeing a lot of action on the YouTube chat window. People are appreciative that you've made time to come here and help us with Morgellons awareness.
I love what it is I do, and I do videos just to help, hopefully. If anyone's ever heard me, I use myself as an example. I like using stories because I love what I do. I'm a researcher at heart. I love research and I love figuring things out. I love being a detective. And, whenever I can share with someone, I'm grateful to have that opportunity. And I thank you for inviting me to do this.
Oh yeah, anytime. We're definitely going to have you back on in the future. Absolutely. Um, what about the one thing that blew my mind with functional medicine was the attention to dental procedures, because I'm usually used to going to the dentist and them saying do this, that, or the other, but you had some different ideas that were very beneficial. What do you recommend, and what do you recommend against in regards to dental care?
That I'm so happy you brought that up, Jeremy, because that is very important. With a lot of these vector-borne illnesses, we find that there's the ability to create cavitations in the gums
Hmm.
that cause persistent infections. And if anything's in your mouth, think about it. Just like it's going to go to the central nervous system. So you have these chronic infections and cavitations that are causing, chronic inflammation and leading to the prolonged illness, okay, just from your mouth. So I always do oral exams and also dental fillings, okay, like mercury, amalgams. I have so many patients who, when I do heavy metal testing as a part of their functional workup, they have tons of mercury. And we know mercury is neurotoxic.
Hmm.
So I've even had patients who've been to regular dentists and have gotten sick after having fillings removed because of that inappropriate extraction, which caused mercury and other metals to seep in the body. So I tend to prefer kind of like definitely fluoride free toothpaste. Oil pulling, that's when you do like, like a coconut based oil or safflower oil and you gargle for about 15 minutes around, swishing around, and then you kind of spit it in the trash can afterwards. That's going to help pull out all those organisms from the cavitations. Okay. I like there's a great toothpaste I like called Dental Cedin, but Biocedin has some binding agents as well to help when you brush your teeth. That's great. And then biological dentistry. If you have, just like I'm a functional medicine doctor, They have functional medicine dentists
Oh,
understand how to remove metal amalgam safely. They utilize things like ozone in the mouth to help with the cleaning process. They use things like chlorella to help bind some of the toxins orally. So I recommend, if you have the resources allotted, to look into biological dentistry and making sure you're not using toxic products to clean your teeth. Make sure you're looking once again at your tongue, because the tongue can be the key to the wellness. Because if you can tell from your tongue, we talked about the yeast, the thick plaques, but you can also have some patterns associated with vitamin and mineral deficiencies. So looking at the oral areas, making sure you don't have kind of ulcers in the mouth, those non-healing wounds, because that could be a sign of viral infection. So it's definitely important that you're taking care of your teeth. I can't tell you enough how often I see poor dentition in my patients, and I'm like, oh, that's a huge missing piece. So
yeah. The great Dr. David Kennedy, I believe, is a functional dentist.
yeah, yeah,
Last question, my friend. Dr. Cornish, what do you feel Morgellons patients need the most?
love.
Wow, that's a great answer.
No, seriously, because I mean, it's not to sound
It's
cliche,
true.
but by now I've treated hundreds of patients with Morgellons through the years, and I'm just so happy to be in this field. But I know that in the patients where it is a dermatologic manifestation of chronic infections, it can be troubling, to have not only the skin manifestations, but also seeing the fibers and having this disease that some people call delusional. They're calling you delusional. You're getting kicked left and right out of offices. Family members may or may not believe you. I mean, it's a lot. It takes a lot on your psyche. And understanding that that's a form of physical trauma, and physical trauma can also compromise your immune system. So I definitely think that's what causes a lot of my patients to try to seek help from the internet and self-treat and self-diagnose, just out of that desperation, out of that need, or out of that feeling that no one believes me. Or that's why in my office, not everyone I see who has Morgellons symptoms has Morgellons, but because I do skin exams. I look under electron microscopy. I have criteria for diagnoses, and it's just finding someone who can listen to you and can help you get those answers. So I think a lot of compassion is needed the most. I think that would be the first thing I would say. And just humility, because this disease, we're just on the brink of discovery of what it is. You know, we're learning more all the time. But as Morgellons doctors, people who specialize like Dr. Stricker, Dr. Savely, myself, people and others who are in the trenches day in and day out, you have to be humble enough to say, hey, I got to try a new approach. I may not know all the answers, but let's keep digging and find out how to get people better. But I definitely think that this may sound cliche, but those are the top two things, the love and compassion. And then just don't give up. Just try to find that person. Don't give in to it. Because if you can find out the underlying cause of your problem, you can get better. So that's what I would say. That's really, and I mean it. I mean it.
Yeah, every person is special, every person counts, and every person has the capability to get better, just about.
Mm, you do.
Do you have time for a bonus question?
I do.
Are you taking new patients? People want to know.
Yes, I am.
So, if somebody wants you to be their doctor, what can they do to get in touch with you?
So you would call Ament. You can go to our website. It's www.amentclinics.com. Or you can call 703-880-4000, or our call center, which you can find at our website. And just get in touch with us. Just say you want to schedule appointment with Dr. Cornish. It's not required that you get a brain scan or you see a psychiatrist, even though I'm a functional medicine doctor that works with Ament Clinic. I also see patients separately for just functional medicine. We do infusions at my clinic. I do telemedicine at my clinic. So I'm always taking patients, year round. And definitely now with the availability and the more lenient restrictions on telemedicine, I'm enjoying doing that, and I'm being able to treat and help more patients that way. So that's how you reach me.
Excellent, excellent. Thank you so much for making time to be here today. And you were here for a little while today. So this is
I didn't fall asleep, everyone, but I had fun. It's always great talking to you. And
and
everybody, just be careful. Stay indoors if you can. Wash your hands. Use your mask, and just know that we will get through this. No matter what, we are going to get there. The best is yet to come. Not only just for this pandemic, but in life. Let's keep fighting, man. Let's get it. Go forward.
let's do it. Dr. Cornish, thank you so much.
All right, my dear. You have a good day.
You too.
Bye now.